Have you ever left the shower feeling refreshed, only to later feel discomfort in an area you rarely pay attention to? Once you pass 70, the body begins to change in surprising ways, and the hygiene habits that once sufficed may no longer be adequate. In today's video, we'll spotlight 3 often overlooked parts of the body that require extra care as we grow older and how neglecting them can result in rashes, infections, or more serious health problems. Stick around until the end to uncover a surprising area that may be quietly impacting your immune system and general wellness. Being aware of this could drastically improve how you feel every day. Before we jump in, I'd be grateful if you could give this video a like. It helps me continue sharing valuable lessons about aging well. If you haven't yet subscribed, I encourage you to do so and enable notifications so you never miss a video. If you find this video helpful, please leave a comment with the number 1. If you don't, comment 0. Your feedback helps me improve future content. Let's begin. Section 1. The feet, your health's cornerstone. Your feet are true workhorses in your everyday routine. They carry your entire body weight, assist with balance, and allow you to walk, stand, or move around with ease. They are central to maintaining your independence. However, foot care is often overlooked, especially in individuals over 70, typically reduced to a quick rinse or a superficial swipe in the shower. Neglecting this area can have serious health implications. The feet are often the first to show signs of physical decline, especially in later life. Taking proper care of your feet is not just about staying comfortable, it's about protecting your health, prolonging your mobility, and preserving your overall well-being. Why foot care becomes increasingly important with age. As the body ages, it undergoes several changes that leave the feet especially vulnerable. Circulation naturally decreases, reducing the amount of blood that reaches the lower limbs. This slows healing and makes the skin more susceptible to injury. The skin itself also becomes thinner, more brittle, and loses its natural oils, diminishing its protective barrier. This leads to dry, cracked skin, calluses, or fissures. Though they might appear harmless at first, these breaks can become entry points for harmful microbes. Additionally, the aging immune system is less equipped to fend off infections. These combined factors make foot care an essential part of healthy aging. For those managing chronic illnesses like diabetes, vascular disease, or nerve damage, the stakes are even higher. Diabetes, for instance, can lead to nerve damage, neuropathy, diminishing sensation in the feet. This loss of feeling means that cuts, blisters, or infections might go unnoticed until they become serious. Additionally, poor circulation common in diabetes and vascular disorder hinders the healing process, raising the risk of complications like ulcers or, in extreme scenarios, the need for amputation. Even individuals without chronic diseases can suffer from pain, irritation, or mobility problems if foot hygiene is neglected, gradually undermining their independence. Frequent foot ailments and their impact. One widespread problem among older adults is fungal infections, including athlete's foot, tinea pedis. The warm, damp spaces between the toes, coupled with thinning skin, create a prime environment for fungal growth. What may begin as mild itching, peeling, or redness can escalate quickly. If left untreated, athlete's foot can lead to more serious conditions such as cellulitis, a bacterial infection that causes swelling, warmth, and discomfort. In advanced cases, this can result in hospitalization or the need for intravenous antibiotics. Dry skin is another prevalent concern that extends beyond aesthetics. When the skin on the heels or soles becomes excessively dry, it can crack, forming painful fissures that easily get infected. These open areas may bleed, swell, or evolve into ulcers that heal slow, particularly in people with impaired circulation. For those living with diabetes, even a seemingly minor sore can progress to a life-threatening condition if it penetrates deeper tissue or becomes infected. Take the story of George, a 75-year-old retired woodworking teacher. After decades on his feet, he remained active in retirement. However, he began to notice his heels becoming dry, and the skin between his toes slightly irritated and itchy. He brushed off the symptoms as typical signs of aging. But within a month, a small heel crack turned into a painful ulcer that didn't heal. A medical checkup revealed a bacterial infection caused by overlooked dry skin. He was prescribed antibiotics and fitted with custom orthotic shoes to ease pressure and aid recovery. George's story underscores the serious consequences that can arise from seemingly minor lapses in foot care. Establishing a daily foot care habit. Preventing these complications begins with a dedicated daily routine focused on observation, hygiene, and protection. Here's a practical guide. Daily checks. Make it part of your routine to inspect your feet every day, either in the morning or before bedtime. Use bright lighting and, if needed, a magnifying mirror to examine for signs like redness, puffiness, dryness, skin cracks, blisters, cuts, or any unusual texture or color changes. Pay extra attention to the areas between your toes, heels, and the soles. If reaching your feet is difficult, ask a loved one or caregiver to help. Spotting problems early can keep minor issues from escalating. Proper cleaning. Foot washing should be more than just a brief rinse. Use lukewarm, not hot, water, and a gentle, unscented soap to avoid irritation. Strong soaps or perfumed products can strip away the skin's natural oils, intensifying dryness. Use a gentle cloth, sponge, or your hands to softly clean every part of the feet, including between the toes, around the nails, and across the soles. If you have trouble bending, a long-handled brush or specially designed foot cleansing tool can assist with reach. Be sure to rinse thoroughly. Any leftover soap residue can irritate the skin. Drying completely. Ensuring your feet are fully dry is just as essential as washing them. Lingering moisture, especially between the toes or on the soles, creates the perfect conditions for fungi to thrive. Gently pat your feet dry using a soft, clean towel, focusing carefully on the spaces between the toes. For those with limited mobility, a long-handled towel or a blow dryer set to cool and held at a safe distance can help make sure no dampness remains. Leaving your feet even slightly wet can result in infections. Smart moisturizing. Once your feet are dry, apply a lightweight, unscented moisturizer to the tops and bottoms to keep the skin supple and prevent dryness from leading to cracks. Choose creams containing ingredients like urea, glycerin, or hyaluronic acid to lock in hydration without blocking pores. Avoid moisturizing between the toes to prevent trapped moisture, which could promote fungal infections. When in doubt, ask a healthcare provider or pharmacist to recommend a product suitable for your skin. Choosing the right footwear and socks. Selecting proper shoes is a vital part of maintaining foot health. Pick footwear that fits correctly, supports your arches, and allows your feet to breathe. Steer clear of tight or ill-fitting shoes that may cause blisters, corns, or pressure injuries. Alternate your shoes each day to let them air out, minimizing the risk of fungus. Choose breathable, moisture-wicking socks made from natural fibers like cotton or bamboo or performance blends crafted for ventilation. Change socks daily, or more frequently if your feet sweat a lot, and always ensure they're clean and dry before use. Toenail care and expert help. Trim your toenails straight across to avoid painful ingrown nails, which can easily become infected. Use sanitized clippers and avoid trimming too close to the skin. If nail care is difficult or you notice thick, discolored, or crumbly nail signs of a fungal issue, consult a podiatrist. Routine appointments with a foot care professional can also help with other issues like bunions, calluses, or structural concerns that could affect balance and movement. The broader perspective. Looking after your feet goes far beyond avoiding pain or infection. It plays a key role in protecting your freedom of movement and independence. Ignoring foot care can lead to chronic discomfort, restricted mobility, and even social withdrawal. On the other hand, following a daily care routine builds a strong foundation for staying active, from grocery trips to peaceful walks. It's a simple investment in lifelong wellness. It only takes a few minutes, less than 10 each day, to make a significant difference in your health, comfort, and confidence. So tomorrow morning, before you slip into your shoes or slippers, ask yourself, have I taken proper care of my feet today? These hardworking parts of your body carry you through each day. They deserve more than a quick splash. They deserve thoughtful care and attention. By focusing on foot care, you're not just avoiding problems, you're laying the groundwork for a more secure, active, and independent life. If you're still watching and finding this video helpful, please drop a number 1 in the comments to let me know you're still with me. Thanks for spending your time here. Part 2. The groin area, a frequently neglected zone with big consequences. The groin area often goes unmentioned in conversations about personal hygiene, frequently overlooked due to embarrassment or discomfort. However, for individuals over 70, this delicate area requires deliberate daily care to maintain health, comfort, and personal confidence. Its warm, damp environment, combined with natural skin folds and possible mobility limitations, makes it particularly susceptible to irritation, infection, and long-term discomfort. Neglect here can slowly undermine well-being, but with a few mindful steps, you can protect your dignity, comfort, and health. Why this area is at greater risk? The groin has unique vulnerabilities due to its structure and environment. Its warmth, skin folds, and moisture from sweating offer ideal conditions for harmful microorganisms like bacteria, fungi, and yeast to thrive. As we grow older, several age-related factors intensify this risk. Reduced flexibility. Difficulty bending or reaching can make thorough cleaning or drying of the area a challenge, allowing moisture and bacteria to linger and irritate the skin. Aging skin. Skin becomes more fragile, less elastic, and may sag with age, forming deeper creases that trap sweat and microbes. Incontinence. Occasional leaks common among older adult skin further dampen the skin, wearing down its natural barrier. Chronic conditions. Illnesses such as obesity or diabetes heighten infection risk. Excess skin or high blood sugar fosters a favorable environment for germs. Clothing and hygiene products. Wearing snug or synthetic garments, or using absorbent items like briefs or pads, can trap heat and sweat, worsening discomfort and skin irritation. These conditions can cause anything from mild itching to serious infections. One common affliction is intertrigo, a rash caused by friction in moist skin folds that can become red and sore. Without treatment, it may escalate to open wounds or more severe infections. Fungal issues such as jock itch, tinea, cruris, and yeast infections, candida overgrowth, are also widespread, bringing symptoms like persistent itching, burning, or rash. In advanced cases, these can lead to painful skin breakdown that interferes with daily comfort and mobility. Early indicators of poor hygiene in the groin area often appear subtly a mild odor, slight irritation, or a bit of discomfort that's easy to brush off. Yet ignoring these early signs can pave the way for more serious problems. What begins as a minor patch of irritated skin might escalate into a raw, weeping rash or an open wound, potentially requiring weeks of treatment with medicated creams or antibiotics. For those with compromised immune function or limited blood flow, infections in this region can quickly become more widespread and serious. Take the case of Margaret, an 82-year-old woman who valued her independence. Despite regular bathing, she began to notice an ongoing unpleasant odor from her groin. Embarrassed, she assumed it was just a normal aspect of aging and didn't bring it up. But the discomfort and odor worsened, and eventually she developed itching. When she finally visited a nurse, she was diagnosed with a mild fungal infection caused by moisture trapped in her skin folds. With a simple daily routine of gentle cleansing, careful drying, and applying a zinc-based cream, her symptoms cleared up within a few weeks. Reflecting on the experience, she said, "I didn't realize how much it was draining my energy until it went away. Taking care of it helped me feel like myself again." How to maintain groin hygiene effectively. Avoiding groin-related discomfort and infections starts with a gentle, consistent hygiene practice. Here's a simple yet effective daily care guide. Daily washing. Prioritize washing your groin every day, even if you're not taking a full shower. Use lukewarm, not hot, water and a gentle, fragrance-free cleanser to prevent irritation. Strong soaps or perfumed products can upset the skin's natural pH balance, leading to dryness or allergic responses. Use clean hands or a soft cloth to gently clean the entire area, including within folds and creases. Don't scrub vigorously, this can damage sensitive skin. Rinse well to ensure no soap residue is left behind. Complete the drying. Just as vital as washing is thoroughly drying the area. Any lingering moisture between skin folds can fuel irritation or infection. Use a soft towel to gently pat the skin dry, especially where skin surfaces meet. If reaching the area is difficult, sit on a chair or use a hand mirror for visibility. A hairdryer set on cool and held safely away can help if towel drying proves difficult. Never leave the area damp. Controlling moisture. If the area still feels moist after drying, apply a small amount of cornstarch-based powder or a zinc oxide cream. These create a barrier that minimizes friction and absorbs leftover moisture. Avoid talc-based powders due to associated health concerns, and steer clear of strong fragrances, which may irritate sensitive skin. If you're unsure which product is best, a pharmacist or healthcare provider can help you choose. Wear breathable fabrics. Select loose-fitting underwear made from breathable materials such as cotton or moisture-wicking synthetic blends. Avoid tight garments or synthetic fabrics like polyester that can trap heat and sweat, worsening irritation, which can trap heat and perspiration. Be sure to change your underwear daily, or even more frequently if you sweat heavily or experience any leakage, and always ensure garments are clean and completely dry before putting them on. For those using absorbent items such as briefs or pads, it's essential to replace them regularly and stick to proper hygiene practices to prevent moisture buildup. Daily self-checks. Spend 15 to 30 seconds each day inspecting your groin for any potential concerns. This could include redness, unusual odor, itching, flaking, or shifts in skin appearance or texture. Use a hand mirror if needed, or ask someone you trust for help with visibility. Identifying issues early allows for timely intervention, preventing them from developing into more serious problems. If persistent symptoms or abnormalities appear, don't delay in seeking medical advice. Healthcare professionals are well versed in these matters and can recommend appropriate treatments like antifungal creams or antibiotics to address issues effectively. The bigger picture: looking after your groin is about more than avoiding discomfort or unpleasant smells. It's about preserving your dignity, confidence, and physical ease. Discomfort in this area can limit movement, disrupt sleep, and discourage social interaction, potentially leading to emotional distress. On the other hand, a basic hygiene routine can offer reassurance, ease, and a restored sense of self, preventing problems that could otherwise impact your quality of life. Though the groin is a private area, its role in your overall wellness is substantial. Caring for it isn't about vanity, it's a meaningful act of self-care that supports your mobility, health, and mental well-being. Just a few mindful minutes each day can go a long way in maintaining comfort and self-assurance. The next time you're tending to your hygiene, remember, the groin is not optional, it's a fundamental aspect of your health routine. Commit to this small effort, and enjoy the lasting benefits of better comfort, confidence, and vitality. If you're still watching this video and these lessons are helping you, please comment number 2 below so I know you're still here. I appreciate your valuable time. Part 3. The navel area, a hidden pocket that deserves daily care. Let's now bring attention to a part of the body often overlooked, seen as insignificant yet vital to your health: the navel, or belly button. This small central indentation on your abdomen might seem unimportant, just a leftover scar from the umbilical cord. But the truth may surprise you. If neglected, this tiny area can become one of the most problematic for people, especially seniors over the age of 70. Without routine care, the navel can collect sweat, debris, and microorganisms like bacteria and yeast, leading to irritation, infections, and even more serious health issues. Let's examine why this happens, why it's important, and how to give this often overlooked area the attention it deserves. Why the navel deserves more care than you might think. The navel is more than just a curious detail of human anatomy. It's a recessed, warm, and frequently damp space that naturally gathers a surprising mix of debris, perspiration, dead skin, clothing lint, leftover soap, and fine dust particles. Many people assume a quick splash in the shower is enough to keep it clean. However, the structure of the navel, essentially a crevice that easily traps moisture, makes it a hotspot for bacteria and yeast to thrive if neglected. This is especially problematic for seniors, whose skin and immune systems become more fragile with age. As we grow older, several age-related changes heighten the risk of issues in this area. Looser skin and deeper navels. Beyond the age of 70, the abdominal area often loses firmness. Weaker muscles and looser skin can create a more pronounced, deeper navel, which easily collects sweat and debris. Weakened immune defense. The body's natural defense system slows with age, making even minor bacterial or yeast overgrowths in the navel capable of turning into larger health concerns. Reduced mobility. Many elderly individuals struggle with flexibility, making it difficult to reach or clean their navel thoroughly. As a result, this area might be skipped altogether or only rinsed superficially. Underlying health issues. Common conditions in older adults like diabetes, obesity, or poor circulation can worsen susceptibility to infections in moist, confined areas. Additionally, anyone with a history of belly button piercings or abdominal surgery may have scar tissue that traps bacteria over time. Early warning signs are easy to miss. Problems in the navel region rarely begin with severe symptoms. They often start off subtly, which makes them easy to overlook. Faint, musty smell. A mild but persistent odor from the navel is often the earliest indication that something is wrong. Redness or itching. Slight redness or itchiness may be mistaken for a skin sensitivity or friction from clothing. Dampness or discharge. A moist sensation, sometimes with slight discharge, is a sign that microbes may be multiplying. Low-grade irritation. Mild soreness or itching that persists beyond a single rinse could be a signal of something deeper. If these signs are ignored, they can develop into omphalitis, a condition characterized by inflammation or infection of the navel. Among seniors, omphalitis can be especially challenging to manage due to slower healing and reduced immune function. A small issue might take weeks to recover from, requiring prescription creams or antibiotics and significantly affecting daily comfort. A real-life example, Peter's story. Let's take the case of Peter, a 79-year-old retiree known for his pristine grooming habits. Peter maintained a meticulous hygiene routine. He bathed daily, kept his hair well groomed, and always stepped out in polished shoes. Yet, he began experiencing a nagging itch around his navel, which he initially brushed off as dry skin or irritation from his waistband. As time passed, the itch intensified. One morning, while his daughter was helping him get dressed, she noticed a faint, musty odor. A medical consultation revealed a yeast infection in his belly button, triggered by a buildup of moisture, dead skin and bacteria that had quietly accumulated over months. Peter's experience serves as a strong reminder that even those who take great care of themselves can easily overlook this small but essential area. Why the belly button becomes more vulnerable with age. Several factors contribute to the navel's increased sensitivity and susceptibility to issues after the age of 70. Changes in skin structure. Older skin becomes thinner and less flexible, making it more prone to retaining moisture, especially in sunken or enclosed areas like the navel. Deeper or creased navels. Weakened abdominal muscles often result in a more recessed navel, or the formation of folds, both of which can trap sweat, lint, and bacteria. Health-related risks. Conditions such as obesity, limited mobility, or diabetes significantly heighten the risk of infections in moist, warm parts of the body. Prolonged sitting or tight-fitting clothing can worsen this by increasing moisture retention. Decreased self-care capacity. Physical challenges like arthritis or stiffness may make it difficult to clean the navel area thoroughly, leading to accidental neglect. Navel carry a simple yet effective routine. Keeping your belly button clean doesn't require much time but does call for mindful, consistent care. Here's how to do it properly. Gentle cleansing. During your regular bath or sponge wash, use a cotton swab, the edge of a soft washcloth, or your clean fingertip. Moisten it with warm water and a mild, fragrance-free soap. Avoid using harsh or heavily perfumed products, which can irritate sensitive skin. Gently clean inside the navel, rotating the swab carefully to remove any debris. Do not apply too much pressure or scrub vigorously, as this may cause irritation. Thorough rinsing and drying. Once you've cleaned the area, use a clean, damp cloth to rinse out any leftover soap residue can be irritating. Dry the navel thoroughly using a cotton pad, tissue, or part of a clean towel. Even minimal moisture can encourage bacterial or fungal growth. If needed, a hairdryer on a low, cool setting can help ensure the area is fully dry, especially if the navel is deep. Routine checks for symptoms. Regularly inspect your navel for redness, swelling, unusual discharge, or strong odor. It should feel dry and comfortable, with no irritation or soreness. If symptoms persist or worsen, don't delay in consulting a healthcare provider. Early treatment can stop small problems from turning into major concerns. Special attention for deep navels. If your navel is deeper than usual, or has folds common among older adults, and those with more body fat, consider cleaning it twice a day during hot or humid seasons. Choose breathable, loose-fitting clothes made from natural fabrics like cotton to reduce trapped moisture and skin friction. Don't ignore pain or unusual discharge. Any signs of swelling, pain, or fluid, especially if it's discolored, or has an unpleasant odor, may indicate an infection that needs prompt medical attention. Older adults with diabetes, reduced blood circulation, or a history of abdominal procedures or piercings are particularly vulnerable. These symptoms should never be overlooked or assumed to be harmless. Looking at the bigger picture, why navel hygiene is essential. Think of your belly button as a tiny, often forgotten storage space. You might not check it daily, but neglecting it for too long leads to a gradual buildup of dust, sweat, and bacteria. This hidden accumulation can easily turn into a stubborn issue. Just like maintaining a clean space prevents clutter, caring for your navel helps avoid infections and discomfort. Incorporating a quick navel cleaning routine into your day is a simple yet meaningful step toward preventive care. It's not about being overly meticulous, it's about maintaining healthy skin, supporting your immune defenses, and stopping minor concerns before they become significant. A well-kept navel means less irritation, a cleaner feel under your clothes, and a lower chance of dealing with lingering infections that could need extended treatment. Most importantly, it's a subtle but powerful form of self-care. Reminder that even the smallest areas of your body matter. If you're still with us and find this information helpful, comment number 3 below to let me know you're watching. Your time and attention are deeply appreciated. Part 4. Final reflections. What these 3 body areas reveal about your health. Your underarms, groin, and navel are not just hygiene zones, they're indicators of your body's health and balance. These often overlooked regions can offer early clues about how your body is handling aging, immune challenges, or stress. For anyone in their 60s, 70s, or beyond, regularly tending to these areas becomes even more vital as your skin, circulation, and flexibility change. Let's revisit the core insights from these 3 important regions. Underarms. More than a place where sweat collects, the underarms contain over 20 lymph nodes that are key to your immune system's toxin-filtering function. If neglected, buildup of sweat, old deodorant, and skin cells can clog this area, slowing down lymph flow and increasing irritation. By washing gently every day, you help your body detoxify more effectively and feel more energized. Groin. Often skipped due to discomfort or embarrassment, The groin is a delicate zone where cleanliness directly supports comfort and self-esteem. Excess moisture and friction make this area particularly prone to infections, especially for seniors dealing with incontinence or restricted movement. Consistent cleansing and drying keep the skin healthy, reduce friction, and support physical ease and emotional confidence. Navel. Arguably the most overlooked spot. The belly button can collect sweat and bacteria if not cleaned intentionally. Just a 30-second habit of careful washing and drying can help you avoid omphalitis and similar infections that may otherwise require days or weeks of treatment. The deeper message: small efforts, significant rewards. Thriving in later years isn't about lavish efforts, pricey treatments, or sweeping lifestyle overhauls. It's about the everyday choices that show respect for your body's evolving needs. Taking just a few minutes each day to clean 3 key areas, the underarms, groin, and navel, can deliver lasting improvements to your overall well-being. Reduced skin concerns. Keeping these areas clean helps prevent infections, rashes, and irritation, ensuring your skin stays healthy and at ease. Greater comfort. Dry, well-maintained skin in sensitive spots minimizes chafing, itching, and soreness, making it easier to move around and sleep peacefully. Improved confidence. Caring for often ignored areas reinforces a sense of pride and control, reminding you that your well-being is worth the effort. Proactive health protection. Maintaining cleanliness in these regions lowers the chances of infections that can sap your strength or require medical care. Seniors who adopt these simple habits frequently notice improvements in their skin, fewer trips to the doctor, and a deeper awareness of their body's needs. They move more freely, feel cleaner, and rest more comfortably without the persistent irritation or odor that can begin with one neglected area. More than anything, they reflect a quiet determination, a decision not to let age stand in the way of feeling good each day. Thank you for being with us as we explored 3 commonly overlooked body parts that have a powerful effect on your comfort and health as you age. When you give consistent care to your feet, groin, and navel, you're not just avoiding discomfort, you're protecting your independence, confidence, and quality of life. What insight stood out to you the most? Was it the value of drying between your toes, being gentle with groin hygiene, or realizing your navel needs more attention? Share one takeaway you'll apply in your routine in the comments below. Your experience might just inspire someone else. If this video brought you value, please comment below and don't forget to like, share, and subscribe for more simple, effective health tips to help you feel your best at every stage of life.